Now we've talked a lot about moving a client. Now sometimes we need extra help to help keep the patient and the nurse safe. So let's look at some other pieces of equipment that definitely can help us do that. So first, let's look at some key equipment that's available for you to assist with your patient care. So first, let's look at this bariatric bed. So this is really key. You may sometimes have a patient that's really tall, or you may have a patient that has a high BMI or a body mass index. You can imagine for comfort, this is really helpful for our clients. Next, let's take a look at the lift. Okay, I know this thing looks a little crazy, but this is really underutilized by us as nurses. So this is really helpful, especially in like the ICU setting, maybe a neurological setting. I use it all the time in the stroke setting, for example. Now, why we use this, if a patient cannot bear weight, their own, or stand or help us, this is really helpful for that, and it really helps keep the nurse and the patient safe. Now I just want to take a small look at this. If you see those hooks up there, this is really meant to use a sling, and meaning it just really is a piece of material that wraps around the patient. We can attach it to those hooks and we can lift the patient out of the bed into a chair. So this is really helpful in what we call a total lift patient. Now next, let's look at the trapeze. So you see the design of the trapeze. Really what you want to take a look at is the triangle piece, because this trapeze can just be attached to a little piece over the bed. This is really helpful, especially for maybe your post-operative back patients, and they need help moving up in bed. But to promote as much independence as possible, they can simply grab the trapeze and then pull themselves up. So this is a really helpful device. Next here we have the slide board. This is really helpful to log roll a patient, put this underneath, and help slide them over. So this is really a great piece of equipment that we use. Let's look at a couple more on this slide. Now you see this one called mattress overlays. So this is going to vary from facility, but most of the time we have actual beds that will do this. But some facilities may have to use their bed that they've got and use an overlay, and we're going to use this to help reduce pressure ulcers, for example. So you may see this, and again, it depends on facility. And lastly, look at this hover mat. So this thing is really great. Let's say you have a patient fall to the floor, and instead of trying to pull on their arms and legs, we can simply slide this under the patient, inflate it, and it's definitely going to help us in mobility of the patient and to move a patient. Okay, so let's take a look at this image. This is called the Client Steady. This is actually another piece of equipment I really think that we underutilize. So this thing's really great because this is going to help move the patient around, but also have the patient help us as well. All this is that we can have the patient hold on to the handlebars. We can put those little blue flaps, have the patient stand on the steady, grab the bar. We can put the flaps underneath their backside, and then they can hold on just kind of like a chair. So this is really helpful if your patient can bear weight, but they can't move long distances. We can take the patient, have them in the chair, move them all the way to the bathroom, or maybe move them to a chair or another area of the hospital. So this is the Steady. This is also a great piece of equipment. One other piece that you may see is a reclining chair. And again, you may see this a lot in your stroke units, neurological units. This gives a lot of patient support because we can recline it. We can set the patient up. Also, there's a food tray here that you can use for your patient. So when we're trying to promote lung expansion and good clear lungs in the hospital, a lot of the times we'll use this chair to get the patient out of bed. So now let's take a look at some other devices to help the patient get around a little bit better. So first, let's take a look at the wheelchair. So no, there's some variations on this. There's footstools, sometimes the side comes off. So there's lots of variations, so make sure you get familiar with yours. What I do want to show you though is there's a standard wheelchair size. So if you take a look at this, it's not very big. So this is not going to necessarily accommodate all of our clients. So let's look at a side-by-side comparison of the standard versus a bariatric wheelchair. So just know that that option's available for patient comfort. So before we go, let's take a look at some other devices. So as you can see, crutches here on one side. Now, one thing to know about crutches is really important you don't just give your client crutches and let them go. There's a specific way they need to be taught on how they walk with these. Also, make sure these are at the appropriate height for your patient. And lastly, we also have canes that can help a person if they really just need support on one side of their body. So if you take a look at the image here, you see that this has got 4 prongs. We call this a quad cane. So there's variations of this, so just be familiar with those as well. Now, we talked about some of those devices, but let's talk about a really common mobility device that's going to go home with our patient. I work in post-op care, and many times after back surgery with patients, we may send a patient home with a walker. So we want to give them instructions such as these for safety at home. So the first thing is take small steps. Now with walkers, there's wheels in front, so we don't need to take large steps when we're using this. Take small steps when you're instructing your client or instruct them to do so. The other thing that can commonly happen with a walker is that many times clients push it way out in front of them and they're taking steps. Well, as you can imagine, that's not great for their center of gravity, and we want to keep the walker close to their body. We want to instruct them, do not push the walker far away from your center of gravity. Now, of course, because the patient's ambulating, we also want to make sure that they don't slip. So instruct the patient to wear non-skid slippers or socks or shoes with traction. Now, when instructing a patient that they're going to use a walker for home use, the other thing we need to talk to our client is about assessing their home environment. Such as anywhere that they're going to be walking or using their walker, they need to make sure that they remove any throw rugs, any excess clutter, so it doesn't trip them up while using their walker at home. Another important point to think about is making sure you instruct your client to keep their head up while walking to maximize their balance. What we don't want to see is the patient using the walker, looking down and maybe pushing forward, because that, of course, will throw off their center of gravity. We want them to look up, keep the walker close. And lastly, as you can imagine, with the walker, we usually give someone the walker because they need a lot more stability than, of course, the cane or maybe the crutches. So many times they've got their hands occupied. So have them keep both hands on the walker, but of course if they need to carry something, they can use a bag or a basket, for example, and they can attach it to it. Thank you for watching.